This segment of Delmarva Life is brought to you by Peninsula Home Care.
Goes without saying that nurses are an important part of society and provide an invaluable service.
And while we should show our appreciation for them all year round, it's especially important this week. That's because it's National Nurses Week. Brian Spiro sat down with 3 nurses from Peninsula Home Care who share what their job means to them, but also what it takes to do their job every day.
When you think of a nurse, you may think of someone who works in a hospital or doctor's office. And while they certainly do, there are also nurses on the road who provide home health care.
Well, we're an outreach for the physicians where we can be the eyes and ears for them.
Benefits of having home health care is just that reinforcement and the liaison between the doctor and the patient.
We have to earn their trust. They know that we are in their home and we need to respect them, and they respect us for what we do for them.
Kim Mast, Shelley Hughes, and Marcy Burke are registered nurses with Peninsula Home Care. Shelley says she started her career as an LPN or licensed practical nurse and moved up from there.
It was easier for me to start with my LPN and start working in the field and then progress part-time schooling to get my RN.
Kim, who was already in the medical field, says she wanted more contact with patients.
I was in a cardiology office, working both in the hospital as a physician's nurse and then in the office at a computer and typing in data and answering phones. And I wasn't taking care of patients. I went to school to be a nurse to take care of patients and make a difference.
And Marcy says this is what she was meant to do.
I knew I wanted to do something to help people. And to be honest with you, there were several nurses in my family, and I saw that the rewards and the satisfaction they had out of it. And I felt like I could do the same, that's something that I wanted to do. I wanted to be able to come home at the end of the day and be proud of what I'm doing and that I'm serving the community.
These 3 ladies have the same knowledge and training as every other registered nurse, but their job is very different. Working for Peninsula Home Care, they treat and monitor their patients outside the hospital when they're in their own home.
So that's where we get to take care of them. When they're comfortable, they're relaxed, they're more open to education, they're more open to everything, and they heal better.
We have to be very experienced, we have to be knowledgeable. We are the eyes and the ears for the physician, and they depend on us to take care of the patients and interact with them in between their office visits, between their hospitalizations and their follow-up appointments with their physicians.
A lot of patients, you find they're ready to be out of the hospital, they're ready to be in the home setting, but a lot of the education hasn't been provided to them, or it may just be that they don't remember what they've been taught in the hospital.
And the care they give to patients 24 hours a day, 7 days a week, 365 days a year is paramount. It helps ease that transition for both the patient and the family when going from the hospital to home.
We want to know what their diagnoses are, what we're going to be teaching them on that day, whether it be medications, diet, activity levels.
We want to go in, we do our head-to-toe assessment, that good old head-to-toe where we look at the person, we listen to them with our stethoscopes, we're looking at our vital signs, we're putting that great big picture together.
We educate them on their medications, make sure they have all their medications in their home, that they understand why they're taking their medications, the importance of it.
We can catch things so much faster in the home and educate the families on what to look for to keep them out of the hospital so much better that 9 times out of 10 they can stay out of the hospital.
And through it all, these nurses have no other medical staff to assist them. They are a one-person show. That means experience and knowledge is of the most importance to handle any situation that comes their way as they go patient to patient. And they do it all right out of their car.
You have to have good organizational skills, good time management skills, and as long as you have that, I have my own little office. I'm my own little me. I'm just out and about.
In our trunks, we have our trunk supplies, and that's our supply closets.
Each one of them has devoted themselves to this type of nursing, and at the end of the day, it all boils down to one thing:
Being able to go out in the community and just give back, you know, really help people where they need it the most.
And our relationships can be long-term, and they do end up being like family for us. And it's rewarding to us as they look forward to our visits as much as some we look just as forward to seeing them.
It feels good at the end of the day to know that you've really helped and made a difference in people's lives.
And just to give you an idea of how important the role of nursing is currently and in the future, according to the Bureau of Labor Statistics, registered nurses or nurse employment will grow at a rate of 26% between now and 2020 because of healthcare demands and aging baby boomers.